Hi, my name's Tricia Buice. I am going to do a physical assessment on my patient. This is for Introduction to Physical Assessments at Columbus State University. First thing I'm going to do is introduce myself to the patient. Hi, my name's Tricia. I'm going to be doing a physical assessment on you. Let me go wash my hands first. You gotta follow me. Oh, you don't have to follow me.
Can I stop it?
No, we're keeping going. 22-year-old female, no previous medical history, no complaints at this time. First, we're going to inspect your skin. So I'm going to look all over your skin and touch it. Skin is nice tan color throughout. Little ecchymotic area noted down at the bottom left leg. It's nice and warm to touch. Dry. Turgor is good. Turgor and mobility are good. I'm going to look at your head and scalp now. Her hair is nice and blonde. Clean. No dandruff noted. Hair is evenly distributed throughout the head. No masses or lesions noted. Nails are nice and well groomed, clean. Pink undertones, flat. They lie flat on the bed and no clubbing noted. And cap refill is less than 3. Gonna look at your face. The face is nice and symmetric. Eyes, ears, nose, and mouth are in its spot that it needs to be in. I'm gonna palpate the temporal arteries. And it's nice and smooth. I'm going to listen to it. Of course, I have no bell on mine, so we're going to have to listen without the bell. No bruise noted. Going to look at the neck, and we're going to test for range of motion. So I'm going to need you to turn your head to the left, to the right, and then I want you to take your head and turn your ear to your shoulder. And the other way. Okay, that looks good. Good range of motion. We're going to look at your mouth. I want you to open your mouth and move your jaw side to side. Open and close. Okay, TMJ is good. No clicking noted. I'm going to look at your trachea, and I'm going to feel it. So I'm going to start down here. Feel the tracheal rings, the hyoid bone is intact, and everything's movable. We are going to inspect the thyroid now. And I need you to turn your chin down a little bit, not that much right there. It's going to feel a little uncomfortable. Thyroid feels no masses are noted. Tracheal is nice and midline. I'm going to assess her lymph nodes now. Make sure there's. So, okay. This is preauricular, postauricular, occipital, retropharyngeal, submaxillary, and substernal. And then these are the superficial cervical chain, and then the deep cervical chain, and the subclavicular. Okay, and there's no the lymph nodes are nice and flat, cannot be palpable. I'm going to look at your eyes now, and we're going to do a few tests to check the movement, the visual fields, and your sight. So these tests are going to be confrontation, accommodation, pupillary reflex, and what they call the H test. So first I'm just going to look and make sure your conjunctiva are nice and white, pink, no redness noted, no drainage noted from her eyes. And then we're going to do the confrontation test. Okay, turn and just sit facing me. Okay, I want you to put this over your one eye like this, same eye that I'm doing, or actually that eye. And then I'm going to put some object out here, and when you can see it in your peripheral vision, I want you to say now. No. Okay. No. Okay. No. Okay. All right. No. 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 Okay. All right. Next one we're going to do is we're going to do accommodation. And what I need you to do is I need you to stare away from me, like at the wall over there. No. Face me. Sorry. And I want you to take your eyes and stare away from me. Okay. And then I want you to bring it back and stare at the light. Stare away. Bring it back, stare at the light. Okay. One eye. Stare away. Bring it back, stare at the light. Okay. Stare away. Bring it back, stare at the light. Okay. All right. Good pupillary reaction. Accommodation is good. Confrontation is also good. We're going to do what we call the H test, and that's going to test the movement of your eye. So, okay. All right, good ocular movement. These tests also are tests that can be used to test the cranial nerves, the trochlear nerve, abducent nerve, and the ocular motor nerves. Next thing we're going to do is the Snellen test, and we're going to test her vision. So I've put the test over here, and she's going to stand over there, which is 20 feet. And you can just put your hand over your right eye and look at this scale. Okay, can you read this line right here.
EDFOZP.
Okay. Can you read this line right here?
FELOPZD.
And can you read this line right here?
DEFPOTEO.
Okay. Now cover your other eye. And can you read this line right here?
EDFOZP. FELOPZD. DEFPOTEO.
Okay. Perfect. 20/20 vision. All right. Now I have a test for the nearsighted vision, and here's the card. If you could come sit down and look at that. All right. So it's got to be about 16 inches away from your face. Let's see. That's this far. Sorry. So you can bring it up a little bit. All right. So can you read this line right here?
This one?
Yeah, can you read that one?
Yeah.
Okay.
LGPF. HEDOT.
No. Try the one above it.
DZECLPTOP.
Okay. Good, good. Other eye?
DZECLPTOP.
Okay. And can you read this line with that other eye?
LGPFZEDOT.
Okay. So your left eye has 16/20 vision and your right eye has 16/24. All right. And that test also is a test that you would use with your optic cranial nerve. We're going to inspect your ears now. So they are bilateral and even, clean. Earring noted in the right upper ear, and let's see, there's 2 holes, earring holes on, 2 on the right and 3 on the left over here. Okay, ear canals are patent, external auditory, canals are patent, no drainage noted. No palpable masses noted. We're going to do what they call is a whisper test, and it is to test the vestibular cochlear nerve. So I'm going to whisper something in one ear, and you repeat. Apple. Paper. Okay. So that nerve is intact. Just feel your sinuses. You have any pain there?
Mm-mm.
Any pain there?
No.
Okay. No masses or lesions noted. And let's see. Can you breathe through that side of your nose? Okay. Can you breathe through that? Okay. Both ears are patent. All right, I need to inspect your throat, lips, gums, mucosa. Sorry. All right, so we're gonna look at your lips first. Okay, pink, moist, skin's intact. All right, smile. Let me see your teeth first. Okay, teeth are nice and white, no missing, very straight without braces. All right, and mucosa. And pink. Do you feel any masses inside? Lumps or bumps? Okay. I'm going to stick my hands in your mouth. Stick your tongue out. Okay. And then you head back a little bit. And can you say ah? Okay. Papillary noted on the dorsal. Lift your tongue up. And the tissue's nice and pink and no inflammation noted. Soft palate rises when she says ah. Tonsils, uvular, and posterior pharynx are pink without inflammation. All right, I have to teach you a breast exam now.
Okay.
I know that your grandmother had died of breast cancer, so it's very important that you do a breast exam every month on the same time, usually 5 days after your period starts. You'll start with just looking with your arms down, looking in the mirror, and just seeing the shape of the breast, that there's no changes or no irregularities. You'll put your arms up, you'll tighten them down, and you'll put them on your waist just to see the shape of the breast and no irregularities. When you do your exam, you're going to want to lift your first arm up, and you're going to start on the edge nearest to the areola, and you're going to palpate around it, and you're going to feel for any lumps, bumps, anything like that that's irregular or painful. You're going to go up to the breast, up to the lymph nodes, right up in the arm, and feel that. Then you're going to actually grab the areola and pinch that and make sure there's no discharge or anything coming from that. You're going to do different levels of palpitation to make sure that you feel the tissue that's closest and that's deep down. And it's very important. It's easier to do it in the shower, but like each time you're going to lift one arm up and do it, palpate with the other arm. And it's a very important fact for you because of the breast cancer in your family. We're going to look at your chest wall now, and let's see. Yeah, go ahead and take that off for now. Okay, so I'm going to assess your chest now, and it looks nice and symmetric. Clavicles are bilaterally even. Sternum is midline. Okay, and then also the respiratory rate, which we did the vitals earlier, where the blood pressure was 115/79, respiratory rate was 16, temp was 98.8, and heart rate was 56. I'm going to listen to your lungs now. Okay, each time that I place my stethoscope down, can you take a deep breath for me? Okay, I'm going to listen to your back now. You're not getting where you can see. Come back over here where you can see what I'm doing. They have to be able to see, they said. Can you get over there? Okay. Okay, breath sounds are clear. Tracheal sounds, bronchial sounds, bronchovesicular and vesicular sounds are at their specific points where they need to be. I'm going to listen to her heart now. So let me Unfortunately, I do not have a bell on my stethoscope. I would listen to the same points again with the bell. I'm going to ask you to lay down on the couch, and I'm going to listen while you're laying down. And can you lie on your left side? And we're going to listen to that way. Okay, so I hear S1, S2, no gallop, no murmur. We're also going to now listen to the carotid arteries to see if there's any bruit. That could be a problem of stenosis, or if you hear any bruit. So I'm going to listen to your carotid arteries. And no bruits noted. I'm going to now assess her abdomen for bowel sounds. And let's see. You would assess all 4 quadrants for a full minute. she's got positive vowel sounds. Normal, about 25 gurgles a minute. I'm going to take my bell now and see and just listen for any vascular bruise, which I don't have one, so we'll listen with the diaphragm. And I don't hear any, no vascular bruise noted. All right, we just did that. The Glasgow-Coma scale on her is 4.65, so it's a 15. She opens her eyes spontaneously. She obeys commands and oriented. Now we're going to be testing the olfactory. And I want you to sit up. And can you close your eyes? And what do you smell?
Something fruity.
Can you smell it on that side?
Mm-hmm.
Okay, what do you smell over there?
Same thing.
Okay. Something fruity is shea body butter. I didn't read anything over, so. That tests the cranial nerve, the olfactory nerve. And now we're going to go to the trigeminal nerve. And what I want you to do is, you can feel this. Okay, tell me when you feel it. Say now. Okay. All right, so I need you to open and close your mouth. This is testing it. And I'm going to feel the muscles in there. The mastoid and the temporal muscles are nice and strong. That's the test for the trigeminal nerve. It's intact. We're going to do the facial nerve now, and what I need you to do is smile. Okay, show me your teeth, what you did. I need you to close your eyes, and I need you to puff your cheeks out. Raise your eyebrows for me. Okay, I'm going to have you close your eyes, and I want you to try to open them. Okay. And then, let me see what else. Oh, the facial test also has the taste test to it. I'm just going to give you a little bit of, is that sweet or sour? Can you taste it? Sweet. Okay, that's good. That's some sugar. And what does this taste like? Salt. Okay, that's good. Your facial nerves are intact. We're going to do the accessory muscles. So what I want you to do is I want you to lift your shoulders up like this and down, up and down. I want you to take your ear to your shoulder without lifting your shoulder up. Okay, other side. All right. Then I want you to try to shrug your shoulders. Okay, good, strong muscles there. Range of motion's good. Okay, I want you to try to turn against me. Good. Turn against me. Good. Okay, good range of motion, good muscle strength. Okay, the hypoglossal cranial nerve. We're going to test that next, and that was with your tongue. So I want you to stick your tongue out for me. Move it up and down, right to left. Okay. Now what I want you to do is I want you to push your tongue against my finger there. Inside your mouth. Yeah, like that. Good. Okay, good movement, good range of motion, and nice and strong, so the hypoglossal nerve is intact. We're going to do what you call is stereognosis, and I'm going to put something in your hands. I want you to close your eyes, and I want you to figure out what it is.
Hair tie.
Okay, good, good. Very good. All right, now we're going to do graphesthesia. So I want you to close your eyes, and I'm going to write a number in your hand, and you tell me what it is. One more time.
A 3.
Okay, good, good, good. All right, point localization is where you can feel the points. Okay. 2 different points. And let me test that real quick. If I can get this thing to break. Which it's not. All right. Usually these are a lot easier to break. You can pause. We're going to test what's called point localization, and it's just to see if you can see the 2 points away. Okay, when you feel the 2 different points, you let me know when. You feel it already? Okay.
Yeah, I feel it.
Okay. All right, and then
I feel it.
okay, and then down here on your feet.
Yeah.
You feel 2 points now?
Mm-hmm.
Okay. All right, that's good. It's intact. We're going to test your tone and your muscle strength. So I'm going to just look at your muscles. I want you to squeeze my hands. Okay. All right. Can you lift your legs up for me? Okay. And good muscle tone. And strength. I want to now have you get up, and we're going to test your gait and coordination. So, all right, let's see. Over here, and I just want you to walk normal. Okay, now I want you to come back with heel to toe. Okay, that's good. Good gait, good coordination. We're going to do what's called the Romberg's test. I want you to put your feet together. This test also tests for the vestibular cochlear nerve also. So just stick your feet together, hands together on your side, and now I want you to close your eyes. And we're going to wait 20 seconds and see if there's any swaying. Okay, that's good. So that nerve's intact. Only minimal amounts of swaying are noted. Okay, next we're going to test the rapid alternating action. Can you sit down? And what I want you to do is, I want you to take your hands like this and move them like that and go as fast as you can. Okay, good coordination. All right, the next thing we're going to do is the pronator drift, and we're going to stand back up for that. Okay, and put your hands with your palms up and close your eyes. If they drift, then we have a problem. Okay, I'm going to push down. I want you to put them back up. All right, don't open your eyes. All right. All right, there's no drift noted there. That's good. Okay, last thing we're going to do is I want you to extend your arms out and close your eyes, and I want you to take your fingertip to your nose with your eyes closed. Okay, good smooth movement, good sense of position. The last thing I want to do, and I forgot to do this earlier, is I need to have you just bend over, and I want to check your spine to make sure that it's nice and straight and there's no scoliosis. And there's not. No scoliosis noted, straight spine. I don't think I've forgotten anything else. So this is the end of our video for this moment. Let's see. Did I forget? We're going to test your deep tendon reflexes now. All deep tendon reflexes are normal. All right, I'm going to check her pulses now. radial pulses, brachial pulses, carotid pulsars are all 2+. Posterior dorsalis or dorsalis pedis and posterior tibial are all 2+. The patient's weight is 125 and her height is 5'5", and per our textbook that gives her a BMI of 21. Thanks for watching my video, and hopefully this is the last thing I've forgotten. Thanks, bye.